Hello and welcome everyone to today's seminar on psychiatric examination and assessment. In this comprehensive guide, we will explore the foundations of assessment, the different components of a mental status examination, techniques for navigating through similar presentations in order to make accurate differential diagnoses, and various other topics related to evaluating mental health. So without further ado, let's dive into the fascinating world of psychiatric examination and assessment. This video explores the key principles, techniques, and approaches used in psychiatric examination. Topics covered include establishing rapport, taking a thorough patient history, using relevant tools, considering ethical implications, and accounting for cultural factors in assessment. The mental status examination, MSE, is a vital tool used in psychiatry to evaluate a patient's cognitive, emotional, and behavioral functioning. In this segment, we will delve into the different domains of the MSE, including appearance, behavior, speech, mood, affect, thought process, thought content, perception, cognition, insight, and judgment. We will discuss the specific observations, assessments, and questions that are essential in each domain. Additionally, we will address common challenges and potential pitfalls in conducting an MSE. In this video, we will discuss how to diagnose psychiatric disorders by differentiating them from medical conditions with similar symptoms. We will cover the diagnostic criteria for mental disorders and provide case studies to help you understand the challenges of differential diagnosis. The clinical interview is a fundamental component of psychiatric assessment, as it provides a rich source of information about a patient's history, symptoms, and subjective experiences. In this segment, we will cover the essential skills needed for conducting a thorough clinical interview, including active listening, open-ended questioning, and empathic communication. We will also discuss the different interview formats, such as structured, semi-structured, and unstructured interviews, and their respective advantages and limitations. Accurately assessing psychopathology requires a deep understanding of the various indicators and symptoms associated with different mental disorders. In this segment, we will examine the criteria for diagnosing major psychiatric disorders, such as mood disorders, anxiety disorders, psychotic disorders, and personality disorders. We will explore the specific signs and symptoms that clinicians look for, as well as the importance of considering the duration, intensity, and functional impairment of these symptoms in making an accurate diagnosis. Cultural competence is a crucial aspect of psychiatric examination, as cultural factors significantly influence the manifestation and interpretation of symptoms. In this section, we will discuss the importance of cultural sensitivity in psychiatric assessment, including the need to understand cultural norms, beliefs, and practices. We will explore the impact of cultural bias and stereotypes, as well as strategies for addressing cultural diversity in diagnosis and treatment planning. Psychometric testing provides valuable objective data in assessing a patient's cognitive and emotional functioning. In this segment, we will explore different types of psychometric tests, such as intelligence tests, personality inventories, and self-report measures. We will discuss the reliability and validity of these tests, as well as their strengths and limitations in psychiatric assessment. Furthermore, we will emphasize the importance of selecting appropriate tests based on the specific needs and goals of the evaluation. Assessing suicide risk is a critical aspect of psychiatric evaluation, as early identification and appropriate management can save lives. In this segment, we will discuss the key factors associated with suicide risk, including psychiatric disorders, previous suicide attempts, family history, and social factors. We will explore validated screening tools, risk assessment scales, and evidence-based interventions for managing suicide risk. Additionally, we will address the ethical considerations and legal obligations surrounding suicide risk assessment. Substance abuse often co-occurs with mental health disorders, presenting unique challenges in assessment and treatment. In this section, we will explore the assessment of substance use disorders, including the diagnostic criteria, screening tools, and comprehensive evaluation approaches. We will discuss the impact of substance abuse on mental health and the importance of identifying dual diagnoses in order to provide appropriate care. We will also touch upon the various treatment modalities available for individuals with dual diagnoses. Psychiatric formulation helps doctors gather and analyze information to create a complete picture of a patient's mental health condition. We'll cover the biological, psychological, and social factors involved, as well as different theoretical approaches and the importance of cultural and contextual factors. Collaboration between patient and clinician is essential. Neurological examination plays a crucial role in understanding the mind-brain connection and its implications for psychiatric assessment. In this section, we will explore the key components of a neurological examination, including the assessment of cranial nerves, motor function, sensation, coordination, and reflexes. We will discuss the relevant neurological findings associated with psychiatric disorders and the importance of integrating neurological and psychiatric assessments to arrive at a comprehensive understanding of a patient's condition. Traditionally, psychiatric assessment has been based on specific diagnostic categories. However, a growing body of research supports the use of transdiagnostic approaches. In this segment, we will explore the concept of transdiagnostic assessment and its implications for clinical practice. We will discuss the advantages and limitations of transdiagnostic approaches and the various assessment tools and techniques that can be used to evaluate common underlying processes across different psychiatric disorders. Psychiatric examination encompasses diverse elements, such as rapport building, clinical interviews, psychopathology assessment, and cultural and neurological considerations. Comprehensiveness, evidence-based strategies, and accurate diagnosis are vital for effective treatment and quality mental health care provision. Thank you for your attention, and I trust this seminar has benefited your clinical practice.